Welcome to Dr. Gore's show. The topic of today's show is New Year, New You, and what's new. You know, we all start our new year with some New Year's resolution. Either that I'm going to exercise more, I'm going to get more fit, I'm going to go on a diet, I'm going to lose weight, I'm going to give up smoking, I'm going to give up drinking. Something or the other, we always decide. We start our new year with really, really good intentions, and then as the day passes, we kind of slip and slide. But this new year, we're going to get better ourselves. New you, better you, your own self, little bit enhanced. So what's new in aesthetics, in fitness, in weight loss, etc. So it's kind of like a synopsis of a lot of aesthetics and weight loss things that are out there. Going first is body sculpting. As I've discussed in few shows before, body sculpting is one of the newer trends in getting into looking better. There are a lot of areas in our body where we have fat, which is very, very hard to lose. We all can go on a diet and exercise, but those areas, which is the submental fat, the double chin as we call it, the love handles, the side of your stomach, as well as flanks where there is deposition of fat, which is really hard. Fat which is in your upper arm, those loose hands are very difficult to lose. Thighs, inner as well as outer thighs, banana rolls just below the buttocks, those are some of the areas which are very hard to lose. And in case of women after menopause, it just gets much and much harder. In case of men, apart from all these areas, beer belly, areas around, breast, as they put on weight, they can develop gynecomastia, and those areas are hard to kind of treat. Till now, the only way to get rid of these specific areas of fat was by liposuction or tummy tuck, where one has to undergo general anesthesia, the surgeon puts in a needle with a hose attached in kind of simple terms, and the fat gets sucked out. But along with getting the fat sucked out, the blood vessels got sucked out. There's a lot of bleeding, a lot of blood loss, anesthesia risk. Apart from there is a big downtime needed, right? After those bruising and stuff, there has to be a special clothing which has to be worn. So till now, it was not convenient for people to do that liposuction because it really was detrimental due to blood loss, anesthesia, general anesthesia, a lot of mortality was associated, and they had to take days off from work. Body sculpting has revolutionized that aspect. So either by CoolSculpt, which is where the freezing of the fat happens, or by SculpSure, where laser leads to lysis of fat cells. Either of those techniques can be used for sculpting of the body. There are a few other treatment modalities which are out there in the market, radio frequency, etc. But the most FDA studied as well as guaranteed decrease in the subcutaneous fat has been demonstrated with CoolSculpt and SculpSure, around 20 to 30% of reduction in the amount of fat. That means that if you have so many layers of fat under your skin, it's going to reduce it by one treatment, 20 to 30% of that thickness. So from here, it's going to go almost 1/4 down with one treatment. If you get two treatments, it's going to go further down. So that is kind of revolutionized how people get themselves looking better, clothes fitting better. And why do that? It's not just for movie stars or TV actors or models or people who are celebrities, but it is also very much needed for day-to-day person. Why? Because if you look better, if you feel better, you're more confident about yourself. You go for any interview for your job, you are meeting your partner, you are dating, even just your own self-esteem starts going up. You feel yourself more confident, you have a better performance. And it's been studied that somebody who feels better, looks better, dresses up a little better, tends to get more points compared to somebody who is not well taken care of shabby looking, not in fit, your first impression at a job interview in first few seconds is decided. And if your first impression is not good, it's not going to help. So that is why looking you're optimized. None of us want to look every day like a movie star, but you want to just enhance yourself. We are all different individuals with different looks and different special, characters that we want to really enhance. So by doing body sculpting, you are getting somebody who has a lot of layers of around the stomach and the waist, you can reduce it. So what is the mechanism? As you can see on the screen, by freezing the fat, you are shrinking. As anything freezes, the cells shrink. They become so small that they get out of the system through blood vessels, through sweat, through urine, through stool, and that number of cells are drastically reduced. This happens from the time the procedure is done to 6 to 8 weeks after the procedure. It's a very slow process, and that's why you don't see any lagging of the skin, any skin, because the skin also pulls at it as the cells are getting, shrunken and destroyed, and then eventually out of the system. The specific area we have discussed. The procedure is office-based, FDA approved. There is no anesthesia, no cut, no downtime. You can do it and go to the gym the same day, your day-to-day exercise. Everything can be back to normal. And nobody, sometimes not even a spouse, needs to know about the procedure. If you need second treatment, ideally we wait for 8 weeks before we repeat the procedure, because you really want to see the maximum effect of one treatment before we do the second one. That way, we can kind of see the progress of the procedure. In sculpture, it's similar principle, but here the laser beam is used. Since it's a laser, it's a little bit shorter. The probes are different. It gives it flexibility to use it in a different parts compared to CoolSculpt, where it is limited with the size and the shape of the probe. Here, because the 4 attachments can be, interchanged the position, so it's more versatile, and the procedure is quick and fast. Now, FDA has approved a submental probe for sculpture. As you can see, the person getting treatment has to wear a headgear. The sculpture is started, and you see the results between 4 to 8 weeks. Because it's a laser, a word of caution, it's a little bit more painful, because when it gives you the current, there is a little bit of shock-like feeling, but it's very, very short-lived. Sometimes for men, when we do sculpture, because it's a laser, it leads to sometimes a temporary loss of hair. So if they do the submental, you might see the beard in that area is not growing. Around the breast area, that can happen. Usually we ask men to shave before they come in for the procedure, so it's not as painful and the hair doesn't get stuck even for the CoolSculpt. So those are the few, warnings. People ask me, is it safe? Is the fat going somewhere else? Is this permanent? So yes, it's permanent. The fat doesn't go anywhere else. It's getting out of your system. And if you maintain your diet and exercise as a regular healthy person, it's not going to come back. Of course, if we keep increasing a diet which is fat rich, the fat cells which are there are just going to expand. And unfortunately, whatever fat cells you've lost by the procedure, you're going to, nullify its effect. So that's about body sculpting. You have my website as well as telephone number. You can make an appointment for consultation. We are running a special for next few months, the New Year special of 25% off. So please call the office and make an appointment. We're going to take a short break, and we'll be right back to talk about laser hair, vaginal rejuvenation, and a newer procedure for weight loss. Thank you. Welcome back to Dr. Gaur Show. Today's topic is New Year, New You, and what's new. So far we've discussed about why do it, why is it important to look better, and what is a body sculpting and different modalities to achieve body sculpting. The next topic is laser. So laser has been used for the longest for hair removal for years. The newer machines are developed to work faster, less painful, by cooling the area first before firing the laser. The advantage being those lasers really work in all skin type. There are type 1 to type 5 Fitzgerald score, depending upon how easily you get sunburn, what is the color of the pigment, your ancestry. Most Mediterranean, Koreans and Indians fall in type 4 to type 5. African American are on a higher scale, and Caucasians are 1, 2, 3. Some of the laser machines were not very good to be used in South Asian skin because it led to burns, because it was not designed for our skin type. Cutera has come up with a newer machine which can be used for stage 1 to 5 or 6 for different issues. Laser is also office-based procedure. It can be used from anywhere for hair removal in an area which is axilla, private areas, legs, face, back. Even men, some of them have a lot of hair on their chest and back, and sometimes it's embarrassing to them to go out and about. Ear follicle, sometimes you see this hair coming out. Why do laser? Because not only it saves you a lot of time and effort and money, rather than go every month for waxing, shaving, creams, etc., the water, etc., which goes with those procedure. And hence, once you do laser, which is either 4 to 6 treatment depending upon the area, which are usually 1 month apart, you are destroying the hair follicle in the different stages of development, and hence you see permanent results after laser. So this newer laser can be used for any skin type, especially South Asian skin. So there are less complications as far as hyperpigmentation, scarring, etc. It's less painful, and they are much faster and quicker to do it. So even the younger kids, girls and boys, are easy to treat with newer laser treatment. Laser also has been used for scars, for acne, for hyperpigmentation, for birthmarks, etc., because it destroys that high level of melatonin or pigmentation and scar tissue, which is thick, to a normal looking skin. The results are really amazing. Some before and after pictures are on the screen, and you can see, especially with acne, some of the younger teenage girls and boys are very ashamed when they have really bad acne. It affects their self-esteem. They feel like they don't want to go out and socialize because they have this bad acne, and that can be treated just with 1 cycle. And the results are amazing because it destroys not only the acne but the bacteria and sebaceous cyst, which is the root cause for development of acne. Now we have with the Cutera probe ability to take care of spider veins. You know, spider veins are dilated veins on the legs. They can be superficial, they can be deep. Sometimes it's associated with hyperpigmentation, and this till now either we treated with sclerotherapy or with vein stripping, where we really strip those big thick veins, which can have its own complication because, say, it is a surgical procedure, anesthesia risk. A lot of time people had edema, swelling after this procedure. With the laser, it's an outpatient procedure. You can treat it. It's only 1 treatment. It destroys that superficial vein by completely blocking it with the laser, and the results are really good, especially with a darker skin person. Now coming to laser genesis, which is a newer way to treat wrinkles and fine lines. You know, before we had to do chemical peel. Really, it led to lots of skin damage, abrasion. Now with laser genesis, it's a very gentle, slow procedure. It's same laser machine. We use it at a lower setting, and you are just firing without touching the skin. What it does, it stimulates the collagen, a new collagen which is more supple. It gives that fresh feeling, tightness, and it brings youth out. And you need anywhere from 4 to 6 treatments on the face, and you can do it every 2 weekly. Same here, there is no downtime. You can do the procedure and go back to work, and nobody needs to know. It improves, it enhances your look. You don't have to undergo a Barbie look. You don't have to look like a really tight silicone baby. And that's the advantage of doing this newer laser treatment, because it is designed to just enhance your natural look. And you don't want to look 20 years old while you're really actually 60, because it's not just going to look right. So this is a very gentle way of enhancing the look without really looking artificial. The next part of our talk is on laser vaginal regeneration. So we've discussed this in the past. What happens as we get older? The amount of estrogen in the vaginal tissue lowers. That means that it leads to relaxation of the vagina, it leads to some amount of atrophy, and that leads to difficult intercourse, pain with intercourse, and then it becomes a negative vicious cycle because it hurts. You don't want to have intercourse. That leads to more atrophy, more shrinkage. Till now we had only some lubrication as initial treatment and estrogen cream as a therapeutic treatment. Sometimes some patient we could not give estrogen because there was contraindication, and also we are worried for the complication because of whatever amount of estrogen which gets absorbed and its systemic side effect. Laser vaginal regeneration has really helped such issues. By doing laser, as you see in the picture, it's the same principle. When laser is put in the vaginal area, on specific areas we fire the lesions, and this can be repeated 2 or 3 times 1 month apart. It typically takes 5 to 10 minutes in an office setting. There is no downtime. You go home and you see the improvement in the secretions, the elasticity of vagina, and improvement over a period of time. This also has been used for lichen sclerosis, where there is a narrowing of the vaginal opening. Those people have really difficulty having an intercourse, as well as sometimes urination because of such an atrophy and narrowing of that area. And now Femilift, the vaginal lasers, have become kind of like a first line treatment for such people. So by stimulating a newer collagen, it increases the elasticity, vascularity, secretions, and it just improves the vaginal health. Secondly, it has been approved to be used in stress urinary incontinence. What happens with menopause or after multiple vaginal births or procedure, or somebody who has constipation, chronic cough, asthma? There is increased abdominal pressure which pushes down the urethra, the pipe which attaches the bladder, which holds the urine to the outside when we void, when we urinate. After giving or pushing or coughing, that increased abdominal pressure is pushing that urethra down, and that hypermobile vesicourethral junction leads people to have stress urinary incontinence. That means that when you are coughing, when you are jumping, you do get some dribbling of urine. This can be very embarrassing, along with some, smell and personal hygiene issue. Treatment so far used to be surgical treatment by putting a mesh or some sort of sling procedure. Of course, it needed anesthesia and complication, perforation of the bladder, perforating into the vaginal area, as well as fistula. Laser vaginal treatment has helped by doing this treatment, especially at the vesicourethral junction. When you are stimulating that area, it builds up the collagen and it pulls the urethra up, and that really decreases the amount of flexibility or hypermobility of the junction, and hence it helps with stress urinary incontinence. These are very sometimes embarrassing and very personal questions. You can call. No better than a gynecologist can do this procedure, and we do it in a very private setting, and you will definitely see some improvement just after one treatment. Most of the time, these treatments are good for 1 to 2 years, and then every few years you might need like one treatment to keep this vesicourethral junction where it is. So none of this treatment so far we have discussed are considered to be health issues, and hence in most insurance companies don't cover this, and we do have a special payment plan and credit card payment option to kind of help people who cannot afford, or they want to just financially spread it out over the payment over a few months. That way they can afford to do the treatment that they really need. Lastly, for weight loss, there are newer treatment and modalities which are available. First, we knew of gastric bypass, then there was lap band, then there was gastric sleeve. These are the different ways of reducing your stomach capacity. If your stomach capacity has reduced, you're not going to eat as much. And if you're not eating as much, your calorie count will go down and you're definitely going to lose weight. This procedures needed a psychiatric evaluation, a pre-op diagnosis of either morbid obesity, hypertension, diabetes, sleep apnea. It needed some sort of complication before insurance company would approve, and it had to undergo a lot of drastic kind of pre-requirements. There has been a newer modalities of how to achieve this. One of them is balloon. This is a procedure where a patient swallows a balloon, which is small tube at initially, and then under ultrasound guidance, it is dilated. What happens? It reduces the stomach capacity, just similar to the other procedures that I have mentioned, but without the anesthesia, without the complication, without any cut. And once weight loss is achieved, usually they say anywhere from 50 to 100 pounds overweight is needed before this procedure should be done, and diet and exercise have failed to help these people. And after the weight loss is achieved, a gastroenterologist takes it out this tube with upper GI endoscopy, which is really a very simple procedure. We look at lining of the stomach for any ulcer, etc. So these are really an outpatient under some sedation and local anesthetic are used to do such procedure. So that's something new for weight loss. There's another aspect which is the most important aspect of what we call as mindful eating. Mindful eating is where we get very conscious of what we are eating, why we are eating, and to pay attention and enjoy the food we are eating. And we're going to do another show on this topic because it's really important to understand why some of us eat under stress at night, binge eating. What does it lead to? What is the psychoanalysis of that kind of behavior? But mindful eating has changed the way we eat. We enjoy the food and eat healthy food at the right time and the right portion. Thank you so much. This is Dr. Hetal Gaur. On Dr. Gaur's show, we are talking about New Year, New You, and what's new to look better and enhance. My number as well as website is there. If there's any question, please email us or call my office. Thank you. Till next time.